We passed an amendment that would permit states to be able to offer their own single-payer plan. This is the first time that such an amendment's been passed. It will strengthen the health care bill and give many people a reason to support it, because states will have the opportunity and the option to create their own plan, as many states are trying to do right now, in a single-payer plan.
Explain exactly how this would work. If it's not being considered at the federal level, how do states do it?
Well, states do it by using the resources that come to states and creating resources within the states to make sure that people within their state have health care. California's twice has passed a measure that would provide for a single-payer solution. Governors vetoed it, but there's strong public support in California, in New York, in Illinois, in New Mexico, in Ohio, and other states, Pennsylvania, for a single-payer plan. It's just that the people in the state would be covered for all their basic health care needs, and when it's possible at a state level, people will see how it can work at a state level. It, I think, will become more acceptable at a national level as well.
And explain exactly what you mean by this single-payer plan, that state by state it could be adopted. Well,
Medicare is a single-payer plan. It's the government pays the bills. Now, government doesn't own all the hospitals under the legislation that I wrote with John Conyers, H.R. 676, that is co-sponsored by 85 members of Congress. Government would essentially be the person or the institution that pays the bills. Right now, we have a system with 50 million people uninsured, another 50 million underinsured, where you have thousands of different insurance companies that are involved in jacking up administrative costs. $1 out of every $3 goes for the activities of the for-profit system, for corporate profit, stock option, executive salary, advertising, marketing, the cost of paperwork. You eliminate that $800 billion a year in overhead, and you have enough money to be able to meet the needs of all people in this country. And when you eliminate the overhead at the state level, you can meet the needs of people at a state level. My single-payer amendment will, for the first time, enable states to have the option to go to a single-payer plan, provided that we keep it in the bill. This is where your viewers come in. I really need support to have members of Congress contacted to say, keep that amendment in the bill so that we can give states the option to pursue their own health care plan if they don't like what Congress is dishing up.
You know, it's interesting. Canadian single-payer didn't begin nationally, but actually began in one province, equivalent of our state, in Saskatchewan. John Nichols points this out in the Nation.com blog that he writes. The initial progress came with Tommy Douglas, who was the premier of Saskatchewan from 41 to 1960, big pusher of single-payer. He's actually Kiefer Sutherland, the actor's grandfather. And he was responsible for this in Saskatchewan, which ultimately led to all of Canada, because Saskatchewan had such a successful health program.
Well, I think that a state, any state, deserves the right to proceed if that's what they want to do. I mean, the whole idea of states having the ability to be great laboratories of experimentation was supported by none other than Justice Brandeis years ago. States can be the incubators of new directions for America, and I think that the single-payer amendment, which I put into the Education and Labor Bill, gives states the opportunity to be able to take a new direction in single-payer if they desire to do so, and hopefully we'll be able to keep that amendment in the final bill. That's where people all over the country need to be heard from, and this actually could help save the health care legislation, Amy, because there are a lot of problems with this bill. It requires people to buy insurance. It'll increase the profits of insurance companies. It leaves a lot of people out. It has many problems, but I think it'd be worth supporting if we can keep a single-payer amendment in it, and because that could then be, in a sense, a lifeboat for people in the future who will look to states to create a plan that would hopefully in the future be a model for the entire country.
All the lobbying money had to be reported by last night. And of the thousands of reports, and they haven't all been analyzed yet, covering lobbying on all subjects, only 3 organizations reported spending more during the second quarter than PhRMA, the drug industry trade group, the American Coalition of Clean Coal Electricity, the U.S. Chamber of Commerce, and General Electric. But we're talking about massive influx of money. GlaxoSmithKline, America's Health Insurance Plans, Novartis, Biotechnology Industry Organization, MetLife, and it goes on from there. What's the effect of this on your colleagues when you have the largest recipients of health insurance money going to John Kerry, of Massachusetts, Max Baucus of Montana, in charge of Senate Finance, which is in charge of shaping the plan? Well,
it's an aphorism in politics and in business that he who pays the piper calls the tune. One of the calamities of the current political financing system we have is that health care is held hostage. I mean, think about it. You know, you hear Michael Steele talking about what they're not going to tolerate. Well, how have we tolerated 50 million Americans being without health insurance? The insurance companies have almost a death grip on our political system. And they can have so much power that they can exclude 50 million people and trap another 50 million in confiscatory premiums, co-pays, and deductibles, just jettison millions of Americans into bankruptcy. And yet we still have this system. And people are saying, well, you know, we can't have a government-run system. Well, frankly, we've tried this system controlled by private insurers, and it's been a calamity for America. 1 out of every 3 Americans is either uninsured or underinsured. And when you consider 1 out of every $3 goes for the activities of the for-profit system, we clearly have to change the equation here. It's almost like a form of slavery that our country's experiencing. When you consider how vitally linked health care is to economic security, the entire middle class is at risk here if we continue to stay in a for-profit health care system. Health care must be viewed as a basic right in a democratic society, or we're just going to be owned by the insurance companies, and our political system will be owned by the insurance companies.
And so what is happening right now, Congressman Kucinich? The latest, the possibility that the bill will not be passed by August, which some have taken to mean it's going to give more time for Republicans and the Blue Dog Democrats to water it down, but they're not even with the public plan, and I'd like you to explain what is being offered, even coming close to the idea of single payer.
Well, it's not close to the idea of single payer. It's mandating that people buy insurance, and it's telling insurance companies they have to sell insurance. Well, you know who wins in that deal? The fact of the matter is this debate is all skewed right now. You know, there are both political parties are in trouble on the issue of health care. Our political system is failing the American people, and it's a bipartisan affair. So what we have right now is a mishmash which is being offered up as reform. Well, no wonder it's in trouble from all sides. I mean, if people were offered a clear choice of a single-payer plan or not and told what the advantages are of having the government paying the bills, eliminating the overhead, enabling all Americans to have not just basic coverage with doctor of choice, but vision care, dental care, mental health care, prescription drugs, long-term care, all covered. If people knew that was the choice they could have, there wouldn't be much of a debate at all. But we're falling back in old ideological arguments when the fact of the matter is the insurance companies are running Washington, and we have to break their hold, and that's why the single-payer amendment that I offered that gives states an option is a small step in the direction of trying to give states the ability to be able to determine their own destiny, and then hopefully America will be able to see in these laboratories of states that we can have a single-payer plan that can save people money and protect people's economic security and their health. Health care is a basic right. We still don't hear of that talked about in the major debate here in Washington about the bill that is being presented.
But do you think that a public plan that's being proposed could lead ultimately to single-payer? Because most people would opt for the public plan, which is the health insurance company's greatest nightmare, and ultimately it would go in that other direction.
I don't know that, Amy. I mean, right now what I see is a public plan that gives the insurance companies the option to pick the people's pockets. As long as you have a public plan, which now is going to be supported by what? Cuts in Medicaid, on the other hand, and undermining benefits to the elderly? Are you kidding me? I mean, this is the balance that's being constructed right now indicates an inherent flaw in the proposal to begin with. Now, I will vote for it if we can keep the single payer in, because I think it'd be worth the price. But without the single payer provision in it, I don't know what's in the bill that would really be worthy of supporting.
Congressman Kucinich, I want to switch gears.